Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor in IEHS. Welcome to our COVID-19 Exposure Recognition module. This module describes the hierarchy of controls pyramid and how it organizes exposure control solutions from best to least desired for worker protection. The hierarchy pyramid orders controls from the best to the least effective in preventing exposure to the virus that causes COVID. For example, vaccination eliminates the virus, which is the best control. However, wearing face coverings when proper distance is not possible is the least desired control. Again, vaccination eliminates the virus, which is the best control. Wearing face coverings when proper distance is not possible is the least desired control. Getting vaccinated is the best thing you could do to eliminate exposure to COVID-19. This process builds up antibodies in your immune system that make the contraction of the virus highly unlikely. Using disinfectants is also an effective way to eliminate exposure to COVID-19. This process kills the virus on contact. Go to the vaccines.gov webpage to learn more about viable vaccines depending on your age group and other medical considerations. Moderna for ages 18 and up, Pfizer BioNTech for ages 12 and up, and Johnson & Johnson Janssen for ages 18 and up are some viable alternatives for vaccines. Regarding surface disinfection, please consult the EPA List N disinfectants for disinfection types, brands, active ingredients, and contact times for maximum effectiveness. Substitution is not an option for COVID-19 exposure scenarios. Here are some examples of engineering controls. Air rushes in to a negatively pressured room. Air rushes out of a positively pressured room. There is no significant flow of air in a neutrally pressured room. Negatively pressured rooms keep contamination inside when a door is opened. Positively pressured rooms have filtered air that rushes out of the room when the doors are opened. By increasing the ventilation, which increases air changes per minute, contaminated air can be filtered or diluted to reduce contamination. In this engineering scenario, ultraviolet C light radiation is used to sanitize the MERS-CoV virus in a hospital setting. Administrative scenarios involving the following options reduce exposure to COVID-19. Reduce the number of hours worked daily in a facility. Reduce the number of people working daily at a facility. Use workplace signage to limit where people could sit or move within a facility to achieve proper social distancing, and have personal hygiene areas where personnel can either wash or sanitize their hands often. Respiratory protection can be provided with a respirator or a mask. Respiratory protection must be approved by NIOSH and OSHA to be labeled a respirator. The key difference between respirators and masks, if surgical or man-made, is that respirators protect the wearer from external contamination when worn properly. Surgical and homemade masks protect others from the wearer's exhaled contamination. Here is a mini quiz. Please answer the following two questions. Which type of control is posting signs or reducing work hours to encourage social distancing in the workplace? Administrative, engineering, or elimination? Which type of control is a vaccination or using disinfectants to kill the COVID-19 virus? Administrative, engineering, or elimination? The hierarchy pyramid orders controls from best to least effective in preventing exposure to the virus that causes COVID. Vaccination eliminates the virus, which is the best control. Substitution does not apply for COVID scenarios, which is usually the second best control. Ventilation reduces concentration of the virus, which is the third best control. Signs directing where to work or cutting employee work hours encourages social distancing against the virus, which is the fourth best control. And wearing respirators when proper distance is not possible is the fifth best control. This concludes module number 3. Be safe and thank you for your time.